Hey everyone! I am absolutely thrilled to have you here today because we are diving into an explainer of what is literally one of the most baffling, mind-bending medical mysteries ever documented. I mean, if you were to look up this case study, which by the way was famously detailed in the British Journal of Gynecology, you'd probably think you were reading some wild science fiction story. But every single detail of this ultra-rare oral conception case is 100% real. We're going to break down the anatomy, the timing, and the staggering biological odds of an event so incredibly rare, it completely flipped the medical establishment on its head.
Okay, let's dive right into this with a question that, well, seems to defy the basic laws of human biology. Is pregnancy possible without a vagina? Now, your immediate answer, and honestly, the answer of pretty much any medical textbook, would be a resounding no way. But biology, as we're about to see, is insanely resourceful. We're going to follow a real-life medical detective story today to uncover exactly how this completely impossible scenario actually happened. We'll examine the evidence, step by step, to understand the exact sequence of events that led to a true, absolute medical miracle.
So, the inciting incident of our case begins with a pretty awful tragedy. A young woman who worked at a local bar was out with her new partner when she was brutally attacked by her ex-boyfriend. He stabbed her twice in the stomach. She's immediately rushed to the hospital in an ambulance. The doctors there, they spring right into action, taking x-rays, running MRIs, locating those stab wounds. They perform emergency surgery, stitch up her stomach, and stabilize her. After about 3 or 4 days, she's completely good to go and is safely discharged. And honestly, that seemed to be the end of a horrific ordeal. But then, an entire 10 months pass. 10 months later, that exact same young woman returns to that exact same hospital in an ambulance, crying out in severe, agonizing stomach pain.
And this brings us to our first major twist, the secret of impossible pregnancy. Naturally, her doctors just assumed her severe bloating and pain was some sort of postoperative complication from her life-saving surgery 10 months prior.
To figure out what kind of gas buildup or internal issue was causing this much agony after 10 months, the doctors decide to run a sonography, an ultrasound. But when they looked at the screen, their minds were absolutely blown. It wasn't gas, it definitely wasn't a surgical complication. Floating right there on the ultrasound, healthy and fully formed, was a baby boy. She was full-term pregnant. Within minutes, the doctors are looking at her, completely stunned, and they say, "You are about to become a mother."
And this brilliantly illustrates the massive roadblock in our medical mystery. Because the patient's reaction isn't joy, it's absolute panicked denial. She looks at the doctors and insists, no, this is completely impossible. She tells them that she has never even had a period in her entire life. When the doctors naturally suggest, well, maybe you underwent in vitro fertilization, IVF, she responds with absolute certainty. She says, look, I am not married, why would I get IVF? And I've been getting treated for knife wounds, why on earth would I do that? She is totally, completely adamant.
To really understand her certainty here, we have to look at her underlying medical condition. Upon physical examination, the doctors confirmed that this 20 to 25-year-old patient has a congenital condition known as a genital organ malformation. So when she was born entirely without a vagina. Much like someone born missing a finger or with a spinal column anomaly, she simply lacked this specific anatomy. Years prior, doctors had explicitly told her that she could never conceive naturally. Her only possible paths to motherhood, they said, would be through IVF or surrogacy.
With the immediate priority obviously being the patient's health, they safely delivered a healthy baby boy via C-section. But once the room cleared, a whole new phase began: the doctor's investigation and puzzle.
The medical team found themselves staring down a completely locked-room biological puzzle. They re-examined her and confirmed the facts. Absolutely no vaginal opening. The skin was completely closed, looked exactly like normal skin. No history of menstruation, no secretions, nothing. Plus, the patient was highly credible and firmly denied any IVF or surrogacy procedures. Yet, they had literally just delivered a healthy baby boy. So, the hospital assembled a specialized team of doctors and psychologists to systematically interview her and finally crack this impossible case.
So how did this miracle happen? Well, the massive breakthrough came courtesy of a specialized nurse and an investigating physician, let's just call him Dr. X. Through some really careful, sensitive psychological interviews, they uncovered a tiny but absolutely vital detail about the actual day of the attack. Now, what's really interesting here is how basic human digestion plays a starring role in solving this. On the day she was attacked, the patient had been starving for 2 straight days. Why does that matter? Well, in a normal state, when you eat food, your digestive system secretes high levels of hydrochloric acid, or HCl, to break it down. That stomach acid is intense. It would instantly destroy any foreign cells, including sperm.
But because she was in a state of starvation, there was no food to trigger the gastrin and HCl. Her stomach acid was practically zero. So when she ingested her partner's semen orally just before the attack, those sperm entered a completely unacidic stomach, meaning they actually stayed alive, swimming right there in her GI tract.
Let's map out this biological pathway because this is where the timeline overlaps in just the most shocking way. Step 1, the semen survives in that unacidic stomach. Step 2, the ex-boyfriend attacks, stabbing her twice in the stomach area. Step 3, those 2 specific knife wounds didn't just cause bleeding, they inadvertently acted like a highly precise surgical tool. The cuts punctured her stomach wall and leaked, creating a temporary internal pathway, a fistula, deep inside her abdominal cavity. And finally, step 4, those surviving sperm traveled out of that stomach leak and directly into her reproductive system, finding their way straight into her fallopian tube.
It is right at this point in the explainer that we shift from looking at clinical data to just feeling absolute awe at nature's own way. A horrific, near-fatal act of violence had inadvertently created the exact internal bridge needed to create life.
So, the crucial point to take away from all this is that it was the perfect biological storm. We are talking billions to 1 odds completely stacked on top of each other. First, this starvation allowed the sperm to survive the normally harsh, highly acidic GI tract. Second, the incredibly precise trajectory of those 2 knife wounds created the perfect leak. Third, the sperm managed to navigate all that internal trauma to reach the ampulla part of the fallopian tube. But the final, most staggering fact of the whole shebang, even though she didn't have a vagina, she still had functioning ovaries that produced eggs. And the attack happened exactly on the 12th or 13th day of her cycle, the precise ovulation window, where a female's chances of getting pregnant are at their absolute peak. Nature had an egg waiting, and against all odds, the exact sperm destined to create that little boy found its way there through a knife wound.
It honestly leaves you completely speechless. It's a case study that really forces us to look at the sheer unbelievable resilience of biology. Nature literally utilized a horrific tragedy, aligned a dozen microscopic variables perfectly, and entirely bypassed the lack of a major organ just to ensure that a single sperm reached its destination. So I'll leave you with this to ponder as we wrap up today's explainer. Does life always find a way against all impossible odds? If you found this as fascinating as I did, I highly encourage you to go look up this rare oral conception case study yourself. Thank you so much for hanging out with me today and keep exploring the incredible mysteries of science.